this indigenous village in the state of Odisha in eastern India, Asha Patra lives with her 20-year-old son. In early March, he contracted malaria.
One evening after dinner, while going to bed, he began to develop a fever. It lasted 3 days. His health kept getting worse. That's when the doctor told us that he had malaria, but we had never heard of this disease nor of its symptoms.
Now, medical authorities have given him this mosquito net to protect himself. According to the World Health Organization, India had over 4 million estimated cases of malaria in 2021, the most affected country in the Southeast Asia region. This number is well above the 1,600,000 cases recorded by the Indian government the same year. Despite this disparity, all figures project the same trend. New infections have decreased in less than 10 years. Since 2015, 50,000 volunteers like Amar have traveled across villages of Odisha, often most affected by this parasite.
Since we started explaining to the villagers what this disease was, we have managed to stop the number of new cases. Before, the villagers didn't know why they were developing a fever. They thought they'd been cursed.
In his sight, stagnant waters.
This water's enough for mosquitoes to reproduce and lay eggs, so it must be emptied.
The result of this strategy, the number of cases have dropped by 90% in just 6 years, according to the Regional Ministry of Health. India aims to eradicate malaria by 2030. Even though the goal seems achievable, this doctor believes that the authorities should not let their guard down.
I will find in deep forest area, forest fringe area, foothills area, and where there is streams. Those places, if they get neglected or we do not address the malaria, they may flare up.
In partnership with the University of Oxford, India has started manufacturing the world's first anti-malarial vaccine. The first clinical trial has shown 75% efficiency rate, a step forward in the fight against this disease, which has caused the death of more than 600,000 people worldwide in 2021.